the changes are creating more concern and questions about masking and vaccination. So here's the biggest change. The agency is now recommending even vaccinated people return to wearing masks indoors in parts of the U.S. where the coronavirus is surging. Right now, Dr. Dennis Cunningham of the Henry Ford Health System is joining us live. The CDC is advising indoor masking in places with high COVID transmission rates. What does that mean for Metro Detroit?
Well, fortunately, Michigan's numbers are pretty low right now, so that's very fortunate. If our rates did start to increase, masking might be helpful.
All right, so masking might be helpful if those rates start to increase. The CDC says the announcement was made because of new information about the Delta variant. They say the science hasn't changed, the virus has. What are we learning that's setting the Delta variant apart and makes it so concerning that we have to go back to masks in some communities?
So the Delta variant, far more contagious. This is the most easily spread of the COVID viruses that we've seen so far. There are some breakthrough cases where vaccinated people get disease. Fortunately, it's not that common, and if they do have symptoms, they're very mild. But the concern is Michigan doesn't have that many people fully vaccinated, and we could potentially have another surge late summer, early fall.
Well, let me ask this. We have known about the possibility of breakthrough cases because no vaccine is 100% effective. But what do we know about vaccinated people transmitting the virus? Is that a concern?
So the vaccines do cut down on transmission, which is great news. But if you do have symptoms after vaccination, it's possible you could transmit it. Part of the other challenge is we know that only about half the people in Michigan are fully vaccinated, yet if you go into most locations, you don't see half the people wearing masks in there. So I think that's some of the rationale for that guidance from CDC.
All right, well, let's turn to back to school. It's top of mind in many families in Metro Detroit. With the newly announced guidelines, is it more important to get eligible children vaccinated? And what should parents do with this information when it comes to their kids?
So I certainly encourage vaccination for kids 12 and older. We don't yet have a vaccine approved for use in under 12. I do think schools are going to need to wear masks for these younger kids when they resume in the fall, just so that we don't have another outbreak because kids get it at school and bring it home to mom, dad, and grandparents.
All right, Dr. Dennis Cunningham with Henry Ford Health System. Thank you so much for your time and insight this morning. Appreciate it.
My pleasure.